Fine, I'll do it. Fine.
You got it? Okay, good evening. I hope you can hear me because I can't see our attendees, but I hope that you are able to hear us. I'm Alison, that you have been emailing at the Dental Wellness Trust. We are still waiting for a couple of more people. So as soon as everybody is in, we will start. Yeah, so shall we want to start by saying hello to everybody? So my name is Alison and I work for the Dental Wellness Trust. Dr. Linda Greenwall, give us a wave, Linda, is the founder of our charity and a very esteemed dentist in the world of dentistry. Dr. Siobhan Hewson is another dentist who's part of our charity, and Dr. Konviser is another one of our very esteemed dentists that we are very proud to have working for us at the Dental Wellness Trust. Hi, Alec. We are hoping this evening to really tell you all about looking after and caring for the teeth of your young children. And obviously, as you know, because you're here, how important that is. I've had a couple of questions through in advance. Someone's waiting to come in, hang on. If during the evening there are questions that you would like answered, please do type them in the chat box. And if they're not answered during the actual talk by all three of our dentists, then we will definitely answer them at the end. So please do type them in the chat box, and I will make sure that we address them before the end of the evening. The other thing is we are recording this for ourselves, so I hope that's okay with you. This will be a recorded piece of, sorry, I'm looking away to a recorded piece. And I think that's it. We are repeating this live on Wednesday night, so by all means, if you find it valuable, and you have friends who you think might find it valuable, do pass on my details that you emailed me on and ask them to join us again, because we'll be delighted to share the knowledge and wisdom of our dentists with anybody who would like to listen. So I'm going to first of all introduce you to Dr. Linda Greenwall, and she will talk to you about the health and dental hygiene of your children. I'm just going to share my screen. I hope you can all see it.
So,
Okay, Linda, over to you.
thank you. Thanks very much. So I'd like to welcome everybody, Diana, Courtney, Alec, and Gabby. And it would be good to actually know a little bit about you and what the questions that you have for us, because we can talk for hours and hours, but we only have an hour today. So we want to make sure that we answer your questions that you may have about your children's teeth. So what we're going to do first of all is take you, show the PowerPoint on the various important aspects of looking after your children's teeth. But the important thing is making sure that we answer your questions that you may have about your kids' teeth. So let's begin. Can we have the next slide, please? Thank you. So a little bit about Dental Wellness Trust. The Dental Wellness Trust started 10 years ago with the aim of helping children to gain good oral health and to address the needs of children, oral health of the children in the UK and abroad. And abroad in South Africa, we look after 20,000 children to help them with their toothbrushing. And here in the UK, we look after about 3,500 kids, and we're hoping to expand our program. And so if you know of a school who would like to help, who would like us to help them with the toothbrushing, we're only too delighted to help. And at the moment, what we are doing is giving some of the children are taking the toothbrushes home and the parents help to supervise the toothbrushing. And some of the children are doing the toothbrushing in schools, and we teach the teachers how to run the programs. It's really key to provide a good toothbrushing for your child. And the research has shown that actually supervising your child at home, nagging them, really works very well. So the toothbrushing programs at the moment are in schools and in nurseries across the UK. Thank you. Let's have the next slide. Dr. Saul, who's going to be speaking shortly, has done a lot of TV work where we have spoken about the sugar tax and the problems with extra sugar in so many food products. And it's often difficult to know which are the best foods to help your children attain oral health because some of the food has got a lot of hidden sugar. So you may see these kind of headlines where they talk about the children's teeth, rotting teeth, and 48,000 children in the UK, in England, go into hospital every year to have a general anesthetic to have their rotten teeth removed. And to us, that's very sad, and we'd like to be able to do something about that to prevent children from having to have their teeth taken out under general anesthetic. And our program started because the two dentists who were working in the hospital in Luton were so upset to see how many children had to have a general anesthetic to have their rotten teeth taken out. They said that there must be a way of helping children before. And so it's the aim of the Dental Wellness Trust to help children now not to have to go into hospital and not to get tooth decay. And that's what we really want to discuss with you tonight. So when things go wrong, you might see these kind of photos where the children have got small brown spots on their teeth or larger brown spots extending to black marks on the teeth. Some of these are because of not brushing effectively. Some of these are due to the sugar diet. Some of these may be nursing bottle where they still go to sleep with a bottle in their mouth for too long. Some of these are because they have juice in the bottle. And some of things may be prolonged breastfeeding, where we're talking about breastfeeding still for 4 years can cause problems. But all of these can be prevented. And it's the aim of the Dental Wellness Trust to prevent these kind of occurrences from occurring. And when we do see this, when it's tiny, to try and eradicate and reduce the decay. And there are many ways of reducing decay, and we can discuss that a little bit later. May we have the next slide, please? How do we prevent it? So there's a multifactorial way of preventing it. The first way is diet. So giving your children a really good health to start by the diet, reducing the sugar as much as possible, making sure that the children brush with a fluoride toothpaste, and that is brushing in the morning and brushing in the evening. Brushing effectively, and we're going to talk about that. Some habits, which is snacking. So children, where they want to snack and eat a chocolate in 1 hour, and then an hour later they want to have another chocolate or another sweet. What we also recommend is that when you decide to give your children treats, the treats should all be given at the same time in one hit, and then the kids brush their teeth. They shouldn't have a little treat for 1 hour and an hour later another treat, because this is when the sugar affects the teeth the most. So also regular visits to the dentist. We like all children to see the dentist by the age of 1, and at least 2 dental checks a year. I know we're in the middle of COVID and that can be difficult, but regular visits for other parents would really benefit the kids to check their teeth. Next slide, please. So let's talk about good brushing. The baby teeth are really important, and babies get their first tooth depending, but normally from the age of 6 months to 10 months. The first teeth start erupting, and those are normally the lower front teeth. The children need that for eating, for speaking, for smiling, for the growth of the jaw, also to hold the space for the grown-up teeth, for confidence and general well-being. The teeth are really essential And they started, each child develops their teeth at a different pace. And the development, the dentist would check the development and the growth of the jaw and the health of the teeth at each visit. There are many different factors that the dentist check when you take your child to the dentist. Thank you. Next slide. So when do baby teeth come out? Normally, the children start to get their teeth from 7 to 9 months. And by the age of 2 years, they should have a full set of 20 teeth. And by 10 to 12 months, they would have had about 8 teeth. And 12 to 16 months, they would normally have about 16 teeth. The total amount of teeth for a primary teeth is 20 teeth. And by 24 to 30 months, they should have all their teeth and be able to use them and eat with them. And then afterwards, the teeth start to fall out. For girls, it's more advanced than boys, but by the age of 5 in girls, we see the lower front teeth starting to become loose as the new teeth are growing forward. And then we would watch and develop and watch the teeth, assess when the teeth were becoming loose and the growth of the child according to the growth charts to see how the child is developing their teeth. Next slide, please. So there are many different baby toothbrushes, and it's a really good idea to help your baby brush their teeth. There's little baby toothbrushes where you would hold it on your finger with a special little brush and get the child used to having their teeth brushed. For a baby, it's a tiny smear of toothbrush, really just as small as you can, a grain of rice. And then you would brush for 3 to 5 seconds per tooth, brushing morning and evening, the last thing at night. I always recommend that if you're brushing the baby's teeth, the baby can sit on your lap and you brush the teeth from behind. When you're looking forward, it's difficult. So I would normally hold the baby, hold their jaw and brush from behind. That way you have stability. If the baby starts to cry, we still brush their teeth gently, just so that they get used to the fact that this is a habit that is a good habit to install, and they brush it, and the parents brush their teeth regularly. Thank you. Next slide. The really important things. So for a baby from 0 to 3 years, there would be a grain of rice is the amount of toothpaste that you would use. For children from 3 years up, we would use a little pea size, a very small amount. If you look on this photo with a Colgate toothpaste, you don't want to, a pea size is the amount, that's the correct size. You don't want to smear all the toothpaste on the side, on the whole edge of the brush. That is too much toothpaste. So you need to get into the habit of having a tiny little pea size. So when you place it on the brush, just the smallest amount, and that a pea size is absolutely enough. You want to use a soft bristle brush, and then you need to get the brush at an angle and do tiny little circles. The best is to use a timer. So when you are getting your children used to toothbrushing, you can set a timer on your phone, or you can find a song that the child likes and play that for 2 minutes and while you do the brushing. So choose a song on your phone and check the time, but just keep going for 2 minutes. That's really the easiest thing. So the child associates the cool song or the fun song with the brushing. Now, when we start brushing the teeth, there's many different parts of the mouth to brush. And so it's not just brushing the front teeth, it's also brushing the back teeth. We want to hold the toothbrush at a certain angle, which is about 45 degrees. So you want to brush the back teeth as well, the front teeth, and we do tiny little circles in a gentle manner. Then we brush the biting surfaces of the teeth as well, tops and the bottoms from the side, and we do little circles. And then the last thing we mustn't forget is to brush the tongue. And you try and teach your child to stick their tongue out, and you gently brush from the back forward, three different brushes, right from the side of the tongue, then the middle of the tongue, and the other side of the tongue. That's really essential because a lot of the bacteria are held in the tongue. And if your child has bad breath or the child is a mouth breather, a lot of the bacteria are kept in the tongue. So you want to just gently, gently brush the tongue, and they get used to that. Thank you. Next slide, please. And just move that along. Yeah. Alison, if you want to change, and the very important.
You want to just mention the spit, don't we?
Yes. So the key thing is to spit out. We don't like children to rinse their mouth. We just spit out any excess toothpaste they shouldn't rinse out. That's really key. That's the message, is spit, don't rinse. Thank you. So these are the different angles where the toothbrush goes. You want to get a child's toothbrush for the correct age, which is normally a small bristle, a short brush, small bristles, a medium to soft brush. Can you see in the picture where the angle is going onto the toothbrush? And we normally would brush 3 teeth at a time at a 45-degree angle, gentle, gentle circles all the way around. Then we brush the inside, and just showing the front on the inside. Then we will brush on the outside as well, and then on the biting surfaces. Don't forget to brush the palate part, the inside, and the lower inside, and the upper palate as well, because many children have staining occurring on the palate area. There's black staining, which you might have seen on your child, and that's often because of the dairy consumption and the connection with the iron and the cheese. But if you want to remove that stain, it's best to brush on the inside palate as well as the outside and the biting surfaces as well. Sometimes you can get your child to bite and then brush all the teeth around at the same time. Thank you. Now we're going to call on Dr. Konviser to continue.
Thanks, Linda. So I'm just going to talk a little bit about fluoride initially. Linda mentioned the reason why we spit out and we don't rinse out is because the special ingredient of fluoride in the toothpaste, that's what we want really to be staying on the kids' teeth to keep them nice and healthy and strong. And I'll come on in a second to explain the different strengths. But, you know, especially the little ones, you know, they don't have the reflex, they don't have the dexterity, they don't have the ability to be able to spit out, obviously. So they're only maybe the little ones are going to swallow some. But as they get older, we do want to encourage them to do this. You know, it comes with age. Generally, from about 3 years old, they become able to. I found that with my children, from about 3-ish, they start to get the concept of spitting out. But, you know, often a lot of parents think, well, you know, if they're swallowing the toothpaste, is that dangerous? Well, like Linda said, we're using a tiny sort of smear for little children and a pea-sized amount for over the age of 3. And really, your child would need to consume an entire tube in one entire sitting for them to get sort of toxic levels or anything, you know, that you would be worried about. And, you know, we really shouldn't be concerned by that. So when we are using the fluoride, you know, it's very difficult because there's so many different brands out there and they've kind of marketed them at slightly different ages. So it can be confusing. So the really important thing to look out for, after this presentation, go and look at your toothpaste tube, and at the back they'll all the ingredients. There'll be one number. It will say sodium fluoride, and it will say 1,000 or below 1,000 is for under 3-year-olds, and over 1,000 is for over 3-year-olds. Often it's about 1,450 is the number you'll generally see for most of those. For most of the stronger toothpastes. But again, for under the age of 3, you want under 1,000. It's really, really important. And again, when we're using a mouthwash, most children, you know, won't start using a mouthwash till they're probably about 8 or 9 years old. It's often just because they will tend to drink it. They won't know how to properly rinse their mouth out. And also the fluoride in a mouthwash is usually about 1/3 of the strength of that in a toothpaste. So we want to be, while obviously it's helpful, to be rinsing out and getting the fluoride on the teeth from a mouthwash, we want to do it at a different time to brushing. So generally you say, at least half an hour, 45 minutes afterwards, or actually maybe you can be doing your mouthwash in the day directly after your meals, and then brushing last thing at night and in the morning before you send your kids off to school. So again, there's lots of different brands. I find that, the little ones up to about the age of 6 years old, they tend to prefer the babies and the Aquafresh and the Colgate's, like kids marketed toothpastes, because they tend to not be as strong. So the spin, like the mint flavor, is not as strong. But then from about 6, 7, I find from sort of the patients that I see, they tend to tolerate more of the sort of the adult toothpaste, which again is absolutely fine. When they get to 6 years old, they can be using these adult toothpastes, not a problem. Next slide. So also just with regards to fluoride, so when you do take your child to the dentist, which ideally should be twice a year, there's recommendations which we sort of abide by, and one of them is we put a fluoride varnish on a child's tooth. Now, this is generally done twice a year, and what it is, it's a very high concentration of toothpaste, essentially, in a varnish, and we paint it onto the child's teeth. And we do this twice a year when a child is considered to be sort of low risk, as in we're not really sort of overly concerned about, any presence of decay, and their diets are pretty healthy. But if we're worried about your child, that maybe they are at more risk of decay, maybe there is the presence of decay when we see them, maybe they've got fillings and we're just not entirely sort of convinced that their mouths are clean, then we would recommend that they would be having the varnish placed 3 or even 4 times a year. And that would then correspond to your child coming in every 3 to 4 months. So again, as routine, your child would be in twice a year, so that's every 6 months, with the fluoride varnish placed on top. But if they are considered to be high risk, they would probably be seen 3 to 4 times a year and have the varnish placed on at each appointment. So I would encourage you, and this is, I should just add, is only from when your child reaches 3 years old or above. So when you do take your child to the dentist, I would definitely encourage you just to ask your dentist if your child is older, if they haven't placed the varnish, just ask them, are they going to? And again, just to discuss this with them. Only the dentist can apply it, or a therapist or hygienist in the practice. The other thing also is we talk about Fisher sealants. Some of you here may have these sealants on your teeth from when you were children. It's kind of like a white filling which we flow onto the top, all like the crevices, and you can see in the picture there the little fissures on the teeth. And we tend to start doing this from when those lower molars, the molars start erupting. Again, it depends on the compliance of the child, and how well that, when the tooth is fully erupted yet. But the idea is that that's then going to flow into all of those crevices and prevent any decay, food debris and sugars getting stuck in there and decay developing. So again, definitely something to encourage you to ask your dentist about. When your child, their molars start to come through, speak to your dentist, ask them about these things, and they should be able to discuss this quite easily with you. Next slide, please.
One of the parents has asked, does it matter if it's the fruit flavoured toothpaste, as long as it's got the right fluoride content? Does it matter what flavour the toothpaste is?
Yeah, good question. There's so many out there, and a lot of them have different flavourings to get the kids to sort of just to comply, really, to do it, because the minty flavours are too strong. And no, that is absolutely fine. Some of them will have there'll be like a xylitol or something like that to give it some flavour, so it's not as minty. But I think the really crucial part is having the fluoride in there. There are see lots of patients that they not necessarily keen to give their child fluoride, but we actually have fluoride in so many things that we eat and drink. If you live in certain parts of the country, your water is going to be under fluoridation programs. So really to encourage you that it's safe to do using, you know, the correct amounts. And yeah, you want to just check the fluoride levels in there, and that's absolutely fine. A lot of them do have different flavorings to encourage your child to actually kind of do it so that they're not put off. Okay, next question. Next slide, sorry. Okay, so yeah, so this is just sort of diet. Now, we know that diet is in pretty much everything. It's, you know, sorry, sugar is in pretty much everything that kids consume. It's very, very, very difficult unless you are essentially going on a completely sugar-free diet, which is very hard, actually. So I think the important thing, you know, we need to be realistic that your kids are going to have sugar at some point in their diet throughout their day. And it's all very good us sitting here and saying, don't ever give your child sugar. But, you know, I think we just need to be practical about this. The important thing is understanding what you're giving your child and knowing sort of what's in the food and just making sort of healthier choices. Again, we want to reduce the frequency at which your child is having sugar. So, for example, if they're having, let's just take a weekend day, for example, you know, they'll have whatever cereal it may be, or maybe honey on toast, or they have sugar on it, or Frosties, which already have sugar in it. Then maybe they'll have something in the morning, a little snack afterwards. They'll have a play date, okay, assuming, you know, post-lockdown when they're allowed to socialize. So that's more sugar in the morning. Then they'll have some kind of snack at lunch, or they'll have their lunchtime. Maybe they'll have a dessert with their lunch. There's sugar then. Maybe they'll have a little mid-afternoon snack and some fruit. So there's still sugars and there's acids. And then they're going to have dinner. And then, so you can see suddenly when you analyze your child's day, and even us as adults, there's sugar constantly, potentially, on their teeth. So that's why when we talk about that first point, reducing the frequency of sugar, you know, we want to try and keep the sugar intake to the main meals. You know, and those in-between snacks are sort of healthy snacks, as it were. And it is difficult, like we said. You know, there's lots of things out there. Some of you may be aware of it. There's this food scanner app, which is launched by Change for Life, which is actually brilliant. You literally scan the barcode of pretty much most products now. It's quite up to date, and it will instantly tell you the sugar content, the fat content, and the salt content. And it's very, very straightforward. It's a traffic light system: red for bad, orange or amber for kind of on the edge, and green for this is safe and this is okay. So, you know, it's really important. And, you know, a lot of companies now and even fast food chains are starting to have like a traffic light system to make consumers aware. The other thing is, you know, just fizzy drinks especially for us as dentists, but it's just an absolute no-no. You know, it's full of sugar, obviously, but then people often say, well, okay, it's fine. I'm only giving my child Diet Coke. There's no sugar. Well, there's so many other things in Diet Coke, but actually we need to also look at the fizz. So there's stuff which makes these drinks fizzy, and it's very acidic, and little teeth are very fragile. They're very thin, and actually sort of constant acid intake, particularly in fizzy drinks, is very, very damaging to everybody's teeth, and obviously children's teeth. It can penetrate through the teeth much quicker. You know, we've all seen kids who have just consumed fizzy drinks, and, you know, we're extracting them basically. So, you know, we just want to be very mindful of that, and mindful of what you are giving your children, because it's difficult. We get it, but, you know, we just need to sort of be more aware. And again, water really is the best drink for them, especially when they're going to bed. Just making sure they're having water to bed. We don't want them to be, you know, having hot chocolate or things like that, on the honey on their dummies, all that sort of stuff. It's just you know, just constant sugar. I've actually seen someone here has said, there's a question, I think, about fizzy drinks. Sorry, I've never given my children a fizzy drink. They had 1 cup of juice a day, very, very rarely. Yeah, I mean, that's great, Courtney. You know, and it's important that my kids, I've got, you know, 2 kids, and they're 8 and almost 6. you know, they've had chocolates, they've had sweets. They're, you know, it's important for your child to taste these things. You know, they're developing, and you know, you don't want them, because if you make it, you know, if you ban them from having them, as soon as they go to a friend's house, they're just going to hit your friend's sort of snack cupboard or snack drawer, or when they go out, that it's just going to be so exciting for them. So, you know, you can give them these things, but I think it's just reinforcing the fact that actually it should be a treat. It shouldn't be part of their staple diet. You know, you pick them up from school, you pick them up from nursery, you shouldn't be giving them really a Mars bar straight away. And as we'll come on to in the next slide, you'll see sort of why, really.
I think Courtney, because Courtney actually submitted that question earlier, and she's concerned about the fact there's yellow staining on her child's front teeth, even though she is very careful and she is brushing with the Colgate anti-acid. Was that what she put? The Colgate Kids Acid Protection toothpaste, but there's still yellow staining. Is there any indication as to why that might be happening on her child's teeth? Anyone?
Yeah, so I mean, firstly, a lot of some foods, there's still colorings in them as well, which can be staining the teeth. Like Linda said as well, there's certain things there which the teeth will pick up more discoloration of. Some children can develop, it's called like chromogenic bacteria. So essentially the bacteria for some kids tend to be a bit more visible. I've seen kids where actually the parents are brushing them really, really well, and the mouths are pretty healthy, but actually they're coming up with sort of brown marks on the teeth. There's different supplements which can stain the teeth as well, iron supplements, things like that as well. They can come up. Developmentally, the teeth can actually erupt slightly discolored with different spots on there as well. Linda, I'm not sure if you wanted to add something there as well. Just unmute, Linda.
So Courtney, which juice are you giving your child? Do you want to mention it? Is it apple juice, orange juice? Because what we normally suggest is actually to dilute the juice, because even if it's apple juice can cause staining on the teeth as well. So we don't like them to have completely pure juice. Rather, it should be diluted, but that could cause it. Even the orange juice can cause some staining on the teeth. If the stains are getting more and more yellow and thicker, then you need to have a look at, you need to get the dentist to have a look at that, because it may need to be removed. Some kids have green stain on their teeth. That's what Saul was mentioning about the chromogenic bacteria. Some bacteria pick up. If your child has had antibiotics, for example, for an infection, some of the antibiotics can cause the staining on the teeth, the orange staining on the teeth, particularly in antibiotics like erythromycin. Even amoxil can cause staining on the teeth. So let us know which juice it is. Thank you.
And just the next one, please, Alison. So this is just really to give us all an understanding about what the recommended sugar intake is for children and adults, men and women. And actually, when you look at it, it's not actually that much. We probably, every single one of us probably exceed that. So you know, actually a child under the age of 2, they really should be having 0 sort of added sugars. Yet we still see, I've seen patients who are, you know, 2 years old, 3 years old, and we are having to remove multiple teeth and sending them, you know, they're the ones that make up the statistics of having to go to hospital, you know, for general anesthetic at the age of 2 years old, because they're having these additional sugars in their diets, be it hidden sugars or sort of parents are maybe unknowingly giving these things to their kids, or in addition to that, not necessarily brushing their kids' teeth. So, you know, making sure that we just, like I said, reducing the frequency of sugars. So you want to get them off there. So, you know, if you just bear in mind that really it's 6 teaspoons of sugar a day for a child between 2 and 18 years old. So Alison, if you want to just move on to the next slide. So normally when we do these types of things, it's live and there's parents and people in front of us. So we often say, well, you know, how many teaspoons of sugar do you think are in each of these products? I don't know
if you want to unmute yourselves and have a guess, we're happy to hear.
For the Mars bar, hands up for Mars bar.
4 in a Mars bar.
Okay, anybody else? Anything higher or lower than 4? Okay, so if you just unveil 4. Okay, so that's 9 teaspoons of sugar in 1 Mars bar. So, you know, you give your child a Mars bar after school, you've essentially given them their entire day and a half of sugar allowance. And so you can see how easy it is. Just, you know, you're just not even aware of this. And, you know, even, you know, us as dentists, we do this stuff all day long. We talk about the stuff all day long, you know, and unless you are, you know, reading up the ingredients and, you know, going, you know, we all do it. We just go and you buy something and that's it. But the problem is that we don't realize it about our kids, the impact it's having on our kids. Capri Sun, any ideas? Anybody? I won't do this with all of them, by the way.
12.
12, okay. Go on, Alison, if you want to unveil that one.
6.
6, good shout. Yeah, there you go, 6. So again, you know, I mean, you know, we grew up with Capri Suns and, you know, you think you're giving them a fruit juice or something like that, but actually these things are just, they've just got so much sugar in them, and it's very difficult. Alice, if you just want to, don't reveal the Coke, because we'll just go to you can do the cupcake as well. But for Coca-Cola, how many teaspoons of sugar do you think there are in a Coca-Cola?
13.
13. Good shout. Okay. Let's see what we've got in Coca-Cola. Okay. So 8.5. But funnily enough, so some of the energy drinks, like a Red Bull, is 13 teaspoons of sugar. So, you know, I know there's a lot of stuff at the moment for getting that banned. But yes, if you see a child who's, you know, drinking a can of Coke straight after school with a Mars bar, I mean, they've had 3 days worth of sugar in the space of what, 20 minutes. And, you know, forget about the tooth decay. You think about loading your child up with sugar and caffeine and what that's going to do to them from a mental health perspective. So just, you know, the impact that can have from a attention perspective, diabetes, heart disease, obesity, all of these things. And this is where it all starts. It all starts at a young age. And that's why obviously everything which we do is all about, you know, getting sort of healthy habits from an early age. If you just want to flick through the rest of them, Alison, the reason why I put innocent smoothies on there is because I actually got in trouble a while ago because, you know, they imply that they're innocent, but actually, you know, their marketing is not, they're not really that innocent because of their sugar content which they had. And just carry on. And actually raisins, even though raisins don't necessarily have massive amounts of sugar in there, it's for small children, they've got gaps between their teeth, okay? And the teeth are raisins are nice and sticky and they get stuck right between the teeth and kids don't brush them out properly or they're not flossing and it's going to ultimately penetrate through and cause problems. So I'd, you know, rather give your child a fresh grape, if I'm honest, and cut that up if you're concerned about the size. And that's it. So I'll just pass you over to Siobhan.
Good evening. So I'm going to take over from Sol. I'm Dr. Siobhan, and I'm going to talk about visiting the dentist. So Alison, do you want to pop the next one on? So obviously we've already mentioned that we really encourage you to visit the dentist by the age of 1. The reason being is firstly, we want to check that the teeth that we expect to have started to arrive are erupting. Also, it gives us a really good opportunity to have a chat with you about brushing and eating habits at that very first visit. Unfortunately, it used to be that we encouraged people to get there by 2, but as Sol and Linda both mentioned, that we actually found that we weren't catching the decay early enough, which is why now the age has moved down to 1. Most children will be seeing their dentist on a 2 times a year basis, so every 6 months, at which visit they'll get the fluoride varnish applied, which Sol already spoke about. But if we have any concerns regarding decay, the health, or even things as small as whether the teeth are coming in the correct order, we sometimes get them in a little bit more frequently, and sometimes 3 to 4 monthly, just to make sure that everything's absolutely okay. Brilliant. Will you just go forward, Alison? Perfect. Here's some pictures of what to expect at your dental visit. Thanks, Sol, for the modelling. This is great. So at your very first appointment, more often than not, we're looking actually to have a chat with mum or dad, and just get the babies used to the dental environment, because they're not really, it can be quite scary. Actually, I must admit that must be one of the positive things about COVID, is that now a lot of people are going around with masks on, so we don't seem quite so scary anymore if you have been lucky enough to get into a dentist for a dental appointment. I know a lot of practices at the moment are doing some of the younger kids' appointments over the phone, or a lot of them over the phone, if they deem your child as to be low risk, and that's absolutely fine. Sometimes if you have any concerns, they might ask you to send in a photograph or a little video. Again, that's absolutely fine, just as long as you're getting the right advice and making sure that you are being seen on a regular basis. Once the kids start getting a little bit older, you'll obviously be expecting the fluoride varnish applications from about the age of 3. And we'll also usually go through some basic brushing technique like Linda already spoke about, whether that be using a manual toothbrush like Linda did speak about, or whether we might suggest that your child might benefit from using an electric toothbrush. And obviously there's Sol with some snazzy goggles in that last picture. Next one please, Alison. Thank you. Yeah, so as I said, what to expect. It's more often a chat with you to see how things are going, and it's a good opportunity to answer any questions, as it is tonight on the chat. So I know you, Courtney, you've been great putting some questions up there, but if anybody else has any other questions, please feel free to ask us. That's what we're here for. We want to get the kids used to the dental environment, so again, used to the masks, the visors, but also things like using the little air brushes or the little air blowers that you see in the suction, because if we do need to do work further down the line, it's much better that they're used to having and used to hearing and feeling these things. So we might not be able to use it in their mouth to begin with, or use a mirror in a mouth. It might just be our fingers, but we'll definitely get them feeling, seeing and hearing all the different noises, so that later down the line, when we do things like fissure sealants or fluoride varnishes, they're not frightened or put off by it. More often than not, we do a basic examination. So what will involve with the children is having a look at, obviously, the teeth that are present. It might not necessarily be how many they have for their age, because as Linda said, sometimes girls progress a little bit quicker than the boys in terms of how many teeth they've got. I've certainly found that with my little one, who's 14 months and doesn't have very many teeth, but that's okay. It's more about the order that they're coming in, and so making sure that everything's coming in the correct order, so we can see that they're roughly tracking on time. We normally give things a kind of 6 to 8 month period, kind of deviation from the dates that were explained earlier. We don't just check the teeth, so don't be deluded and think we're just looking at teeth. We'll also check the gums, similarly to what we do in your own dental appointment, because children can be affected by gum problems too. And we also check the soft tissue, so things like the lips and also the tongues. If your child is over the age of 3 and they are compliant, we will probably put some fluoride varnish on twice a year, as Sol mentioned. And we do tend to recommend the hygienist from about the age of 6. Again, it gets them used to having a dental procedure done, so if there is anything that needs to be done in the future, it's much easier to do so. But it also gets them into good habits for a lifetime. And we all miss bits, myself included. We all miss bits when we brush our teeth, so that's where the hygienist is really, really useful. Now, there are things that you can do as a parent to help us by the time they come to the dental surgery. First, I would always recommend, as everybody is, that we brush our teeth twice a day. So we're practicing putting things in our mouth, but also it explain to your child about going to the dentist that we're going to count the teeth, we're going to see what's there. You try and avoid words like pain, hurt, or scared. I know a lot of adults can be scared of going to the dentist, and I completely understand that. But a lot of dental phobia in children actually comes from the way that their parents are acting in those situations. So if you are a dentophobic yourself, it might be wise to ask your other half to attend, like the mum or the dad, to attend the dentist with the child to begin with, so that they get used to the environment rather than projecting your own phobias on the child. Don't say you're going to go to the dentist as a threat. Never goes down well. So please try avoid that one. The other things you can do is you can get some lovely books and some lovely videos online about trips to the dentist. I know there is a Peppa Pig one. Peppa's a little bit unruly at the dentist, so I don't often recommend that one, but there is a nice Ben and Holly one. Ben and Holly go to the dentist, which is really nice for young children. But yes, Peppa's a little bit unruly. So I'd watch out that one, but there's a good book about Peppa going to the dentist. So you could try that one if you like. Next slide, please, Alison. Oh, again, here's some pictures of Saul. Thanks, Saul. You're very photogenic. Other things that we like to check at dental appointments, and we always like to talk to parents about, are habits. So things like thumb sucking and the use of dummies. Obviously, as much as possible, we would advise against thumb sucking and the use of dummies, as they can cause a whole range of problems, such as you can see in these teeth here, these gaps between the front teeth, which are really characteristic of particularly thumb suckers more than dummy users, because you can generally take a dummy away, whereas you can't chop off a thumb. Now, I must admit, I never thought I would use a dummy with my own child, and lo and behold, 3 weeks later, the dummy was in the mouth after he was born, because he just wanted to suck. What I would advise is definitely get the dummy off of them before 12 months. We did it at 10 months. If you can even go before that, I would recommend 3 to 4 months. Much more straightforward than when they get to the 10, 12 month, just because they have a little bit more personality and it's a lot more heartbreaking for everybody. The way we decided to do it was we went cold turkey, took all the dummies away and just went for it. We had about 3 nights of crying. The first night was the worst, and he has never mentioned it ever since or looked back. So what I would say is, if you have got a child with a dummy habit, I would do it before 10 months. I know it says 12 months here, but you will find it much easier if they're not sleeping anyway at 3 to 4 months to do it then, rather than disrupt a sleeping pattern later on. The reason we took it off of him was because he was throwing it out of his cot and then waiting for us to come back in and put it back in. So, cheeky little monkey. Thumb sucking, ideally before 3 to 4 years, but again, the earlier you catch this, the easier it's going to be for you to get them to stop. Thanks, Alison. Just because, again, it's much harder when they're older, and especially, you want to do it before they go to school, because you have no control over what's going on at school. So I would definitely encourage that to stop. The main problems with the dummies and the thumb sucking, apart from obviously the need for orthodontics later, as you can see in the pictures here, but it can also cause trouble with speaking and speech development, especially if they've got a thumb in their mouth or a dummy in their mouth all day. And it also can have a problem with eating, especially when they start losing their teeth, and they can struggle a little bit to eat certain foods. So it's just something to bear in mind. Next slide, please, Alison. So obviously now, especially if you've got young children, particularly little boys who like to jump around, you may be familiar with trauma or trauma to the lips and teeth. It's always important that you get this checked out by your dentist as soon as possible. The reason being is the baby teeth are very, very important. What they do is they obviously allow the children to eat, but they also maintain the space for the adult teeth to come into the correct position. So just because you've had a knock to a baby tooth, it doesn't normally just impact the baby tooth. Right behind that baby tooth is an adult tooth that's developing. So often if you've had a trauma such as the one here, where they've had a bash to the front, there can be underlying problems that are starting to occur in the adult tooth. Now, in truth, we're not really going to know what those problems might be until that tooth erupts, but it's always really important that we note that there has been a trauma, so that when we do see a problem in an adult tooth, we know where it's come from. And we can also see if there are different ways that we can treat it if we know where and what has caused the problem. If you do find that you get any knocks like these, as I said, it's really important to check with the dentist, especially if they've been outside, because sometimes you can have gravel and bits that get caught up, which we can wash quite quickly and clean quite quickly, which will help prevent problems later down the line. The other thing that we tend to look for is obviously any untoward lumps and bumps in the soft tissue, so the tongue, cheeks and lips. Now, as you can see in this picture here, this little kid has got this strange patch on the left-hand side of his tongue here. And actually they'd gone to the GP and they didn't know what was causing the patch. They went to see the dentist. It wasn't there all the time, but it kind of came and it went. And actually what we recommended was that they had an allergy testing, and we found out they had a gluten intolerance. So it's really important that you don't just necessarily go and see your GP for problems in the mouth, because they tend to operate from the tonsils back. They don't always see what's going on in front because they're not used to looking at that area in truth, and they have a whole range of things to be looking at in the rest of the body. Whereas we are used to and trained at looking at tongues, teeth, lips, and we can pick up on some of these more subtle things that can often help diagnose bigger problems, particularly in the GI tract, which is the gut and intestine. So it's particularly important to look at that. Other things that can be in the mouth are things like ulcers, where there's a bit of trauma perhaps, or if there are other things causing recurrent ulceration in the mouth, or little blisters. Again, it just helps to signpost you to the right place to get these things investigated further. I must make it totally clear that a lot of these things are very, very rare. However, as you said, we see a high volume of mouths, so we have a better eye for picking up some of these nuances. So it's definitely worth going. Absolutely. Remember, you only have one set of teeth. I always tell this to my patients. It says, your baby teeth are your practice teeth, so practice on them well. Your adult teeth are your real teeth, so look after them well. And the third set of teeth you have are very expensive. so don't go there. So look after the ones you get. Okay. Alison, yeah, perfect. Obviously, we are a charity and we rely on your fundraising donations. So there are a couple of ways that you can do that through our Just Giving website, and you can scan the code there to get to it, or you can call up the Dental Wellness Trust and do it over the phone. I should also say that at the moment, I realize COVID has hit a lot of people very, very hard, including us as a charity. Usually we hold a lot of fundraising events, which we've not been able to do. So this year we've done something slightly different, and we've worked with a colleague who's a dentist, but also an artist, to create some really lovely seasonal greetings cards. We have our Christmas collection and also the holiday collection. And if anybody would be interested in purchasing any of those, you can always drop me an email and I can arrange that for you. They're really lovely, or if you want to see some bigger pictures, I can send them out to you as well. They're really beautiful sets of cards, and all the profits and proceeds of those go towards helping us run events such like this, and also helping our supervised toothbrushing programs in schools. Thank you very much for listening. If anybody has any questions at all, please pop them up in the chat window, or feel free to open the microphones now and you can ask us absolutely anything you like. I hope you found that really helpful.
Okay, so now I can have a look at the chat. So there were some questions that were admitted beforehand. In answer, Linda, Courtney answered you that she does use turmeric in her cooking, and they do get diluted blackcurrant juice as to regard the staining. I don't know, Courtney, if you want to say any more about that, about the concern you have for the staining, or the fact that it's very yellow. I know that Courtney also had a concern that at the moment it's very hard to get in to see a dentist as well. So maybe we can give you some advice there if you want to elaborate, Courtney.
Okay, I've noticed for a while, maybe about 3 months, that the staining on the bottom front teeth, and I've done everything in my power to try and eliminate the staining, and it's just not disappearing. It's not getting worse, but it's not improving at all. Hence why I'm thinking, is there something else that I could try to eliminate the stains, from happening even more?
Courtney, how old is your daughter, did you say?
She's 4.
She's 4.
Yeah.
It could be the buildup of calculus, like we get sometimes on the back of our teeth. So it could be that. Often we find when the teeth erupt initially, if you've struggled to get a hold of them to begin with, which is really hard because they're so small, and that it builds up from that point. So if you're really great at the brushing technique and you're really getting in there, as you say, it doesn't often get worse, but you just can't get rid of it. And the only way to get rid of it is to go and see the hygienist to have it cleaned off. So that could be, I mean, if she's 4, it depends really how she is at the dentist, and whether you'll be able to get
previous experiences at the dentist has been absolutely fine.
Has it? So
yes, I think that probably would be the next step.
Yeah, that's what I would recommend. I don't know about Linda and Sol, but from what you've described, without seeing it myself, it could be that.
Okay, thank you.
Did you say you're having trouble that your dentists aren't reopened yet?
They haven't yet. No, I had an appointment a few months ago, and I got a courtesy call from them just saying that only taking emergency patients at the moment, and I haven't had anything. I've not had any, correspondence from them stating otherwise as of yet.
So maybe give them a call and
yeah.
I would follow up with them. So when did you say the last time you spoke with them was?
Maybe about 3 months ago.
Yeah, so for those first 3 or 4 months post lockdown, it was very much only emergencies. Within the last, I'd say 6 to 8 weeks, the NHS practices are starting sort of open things up again, and a lot of it was very much down to the PPE and everything. So I would, they've also, don't forget, they've probably got a massive backlog as well. So I would just proactively call them and just ask them, just tell them for your child, and they're due an appointment. Can you get something booked in?
Are you London based, Courtney? Or are you in the country? I know obviously with the Wales lockdown, I think they've gone back to emergency only again. So
really?
I didn't know if she was based there. And obviously if she's in Scotland, they've only just reopened the services this week. So
okay, I don't know if Courtney can still hear us, because she also had some questions about any unhealthy signs she should be looking out for. I don't know if you were happy with all the advice you were given, Courtney, during the talk, and how much fruit a day can have a bad impact on their teeth. When should they eat fruit? And can it I think she might have gone. But anyways, interestingly, is there a limit to fruit that children should eat in the day? Is fresh fruit better than dried fruit? Should it be as part of a meal? What's the best thing to do with fruit? Because it's considered a healthy snack, but does it have an impact on their teeth?
So the fresh fruit is better than the dried fruit, because the dried fruit has a lot of extra sugar. So the children, everyone should have 5 fruit a day, the 5 helpings. But with the children, eating fruit is healthy. So they would eat their amounts for that age group. And if they like fruit, it's good to encourage them to actually eat the fruit to start with a healthy diet. So that's a good thing.
Sorry, we lost Courtney, but she's back now. Courtney, we're just talking about how much fruit is good a day, and that fresh fruit is better than dried fruit.
Okay.
Because you asked about how much fruit is too much, or so. Yes. Sorry, Linda, if you could just Courtney.
Yeah. So there's the 5 fruit a day is healthy, and so whatever your child likes really. cut up fruit is really healthy, and just encourage them to have fresh fruit. Obviously, there's a discussion between natural sugar and refined sugar, but if they like to eat fruit, then encourage them to eat fruit. That's great, and veg as well. But most kids, that can be a struggle. But gently feeding them is good. Your next question was about trauma to your child's tooth.
Unhealthy signs.
Yeah, they were worried about. How old is the child who had the trauma?
She's now 4.
Oh, okay. So, and did she fall on her front teeth, on the top teeth, or the bottom teeth?
It was the top two front teeth.
And the teeth didn't go brown, didn't go black or brown?
No.
That's great. And did the teeth get more loose?
Ever so slightly after it happened. It is still slightly wobbly now, but it's not as bad as it was.
Okay. So if she's got no signs of bleeding, swelling, trauma, abscess, then I would just let it, leave it alone, brush nicely. The teeth may come out sooner, but normally if a girl, the teeth can start to become wobbly 5 or 6 years old. So those teeth may come out, they may come out sooner. The trouble is that sometimes the permanent tooth can be damaged underneath. There could be a white spot, but you'll have to wait and see. We don't know, so we'll have to just wait and see. As long as there's no infection or anything around that now, then I just let it go and just check it periodically. You can lift up the gum and just check that there's no gum boil on the top of those 2 front baby teeth, just to see if there's no abscesses. But apart from that, I would not worry and just keep it clean and check it regularly yourself.
Okay, thank you.
The question was about the staining and the turmeric. It's probably the cause. And did you say that it was apple juice or orange juice that you like to give your child?
It's apple and blackcurrant diluted.
Okay. And how do you dilute it?
With water.
You say like half and half?
I do the slightest amount of squash with more ratio of water.
Okay, the more water the better. That's great. Yeah. And then if you
do you keep the juices at meal times, or do you have them in between?
It's very rare. I mean, they do prefer to have water. Sorry, I lost you then.
Yeah, that's okay. I would just recommend if they are going to have diluting juice, that they have it with their meals. Okay. And even similarly to the comment that Linda was making, about the fruit, I tend to serve fruit as a pudding, as a dessert. Yeah. And I tend to find that's the best time. It just minimizes the amount of sugar they have, or the not really the amount of frequency throughout the day. So then for snacking, I tend more down the line of things like baby balls, rice cake, bread sticks, things that are more savory, so that you're kind of giving the teeth a bit of a break in between.
I think just also on the diet, the fruit, especially like the citrus, eating like loads of satsumas and things like that, there's very acidic. And like I mentioned a little bit earlier, the acidity in these fruits, on little teeth especially, it can be quite destructive. So like Siobhan was saying, do try and keep those high sugar, high acids to the meal time. It's just sort of reducing the frequency at which they're having it throughout the day to having it sort of in, their one sort of lump sum, as it were.
Mm-hmm. Okay, thank you.
So that was all the questions we had on the chat. If anybody else wants to unmute themselves. Alec, go ahead. Nice to see you. Good evening.
Evening. Thank you for that. It's all very interesting. A question, we've got a 4-year-old and a 6-year-old. They do brush their teeth twice a day, and we do try and supervise it and monitor it. Is there any way of checking how good a job they're doing?
Absolutely. Have you ever heard of disclosing tablets?
No, but I've got a suspicion as to what it might do, but please.
They're great. I normally recommend people use them for kids roughly about your age once a week to begin with. I would always say to do it last thing at night. Don't do it at the one before school, because you'll just stress everybody out. Pop a little bit of Vaseline on the lips, and you can get these little tablets. They're just basically a beetroot dye. You can get them from most pharmacies and Boots, and your dentist will probably have some as well. So what to do is get the kids to brush their teeth. After they brush the teeth, they chew on the little tablet, as it is just a vegetable dye. I get them to spit out and have a little rinse with water as well. And what it will do is all the areas they've missed, it will show up a beautiful dark purple.
Okay.
So great for this time of year if you want to have a Halloween party. Obviously you can't really have a Halloween party, but yeah, they'll show up all the bits in purple, and then they can re-go over it and brush all the bits they've missed. So as I said, I tend to like people to do it about once a week to begin with at this age. Once obviously the kids get better at brushing, you don't have to do it as regularly, but it's really good for a spot check.
That's
I know that's a little bit evil, but they're great.
I think also just if you do, when your kid's obviously spitting out, if you do notice actually they're spitting out any blood, you know, the gums shouldn't bleed if they're healthy. Okay, yes, maybe you've gone too hard or they've traumatized them, which would happen occasionally. But if they're frequently spitting out blood, that means they are suffering likely from some kind of gum inflammation. And like Siobhan was saying earlier, you know, kids, we do check the gums as well, because kids can suffer from gum disease. So again, if you see that, you know, get in contact with your dentist. That's also something to be aware of.
Another thing you can do, Alex, is to set up a chart in the bathroom and do like a reward system with the kids. So every time they brush, you tick it off morning and evening and just stick the chart on the bathroom and do a reward system for them. And if they've brushed really well and they've brushed the 2 minutes, it really, really helps to nag your kids. And it really especially helps to stand there and watch them do it. And actually on the 4-year-olds, sometimes it's good to just get in yourself and brush for them. Let them, so sometimes they're very independent. They don't want anyone to touch their teeth. But I would say I have 4 kids, 4 boys. And so I would brush first. I would say they brush first and then I would brush afterwards. And then I normally stand behind them and then hold the lower jaw and then just brush myself just to check that they're brushing nicely, because sometimes they brush too quickly and they're in and out of the bathroom in 5 seconds. And so that is why I like them. They know that they've got their songs that they love. So choose a song that they like, their song, switch it on, put it on the phone or on their recorder, just switch it on, and they have to stay in the bathroom while the song goes on, brushing their teeth. And all those things create brushing as a fun thing. It's not like they have to do it and it's punishment, but it's quite fun and they love it. So all of those can help to get the kids into good habits to brush well.
So do you have advice about them lifting their top lip so they can get to the gum line up here? Because in those very early pictures of the decay, the little brown spots were up near the gum line. So what advice would you give to sort of make sure the children are reaching those spots if they are brushing independently?
Depend on the age of the kid. It's the parent that needs to help as well. And where the toothbrush goes, the toothbrush needs to go at the joint between the gum and the teeth first. And you hold, that's the key area, because that is where the plaque develops, at the joint between the gum and the tooth. So that's where you go first, onto that gum area, very, very gently in little circles, all the way around on the outside, then the inside, then the brushing, then the biting surfaces, and then the tongue as well.
Okay, so there's a message here. Oh, sorry, Siobhan's answering in the chat, but Zian's asked, for a 5-month-old, should we be brushing their mouth, gums before their teeth come out? And Siobhan, do you want to answer that as you put something there?
Yeah, I would definitely recommend starting brushing before. Firstly, it gets them into a really good habit. And secondly, you may not notice when that first little tooth comes up for a few days or sometimes even weeks, because they can come up quite slowly. As we were mentioning earlier, when they first come in, they're actually quite vulnerable to getting a lot of plaque in there because you don't notice them, so you don't necessarily clean them as well. So the sooner you get something in there, the better. I particularly like the little finger brushes. I think you saw them on the picture, that they kind of slot over your finger, and getting those in, because you can really get those in and around. Whereas with the little ones with the actual handheld brushes, I found it personally very hard to do that. As they get older, obviously, you're going to want to get them onto one of those soft bristled brushes. You can get these little things that they hold to chew, like the matchstick monkeys, or you get other ones that you get from Brush Baby that have a little handle and a guard and a little silicone brush. So the way that I do it now with my little one is he does one and I have the other one that I can get in whilst he's doing it. So it's a bit of a two-pronged attack, but it does work. But again, we've brushed ever since day one. I've just got something in there every night, and it just helps get them used to it, and it gets them into a really good routine. So even if you can't see anything there, really get in there.
Just to back that up, also those teethers, you know, you can stick them in the fridge and things like that because it's quite nice and cold. So for the little ones, it's just really soothing on their gums. I think, is it Sophie the giraffe? Is that still around? Like, you know, all those types of things. Some of them can go in the freezer, not all of them. But it's just really nice. And again, like Linda was saying at the start, you know, the first teeth, so see, you know, you're holding your baby there, you know, those front teeth, 5 months old, they're going to probably start coming through pretty soon at the lower front. You know, even if you're struggling with one of those brushes, you could even just get a little bit of gauze, maybe in some salt water, just to sort of rub the gum around where the tooth's coming up. Because what can happen is if bacteria does start to collect around there, the gums can just get a little bit inflamed. It can be sore. It's, you know, it's sore. It's like having essentially a cut in your child's mouth. That's what it feels like to them. And, you know, and it's really uncomfortable. And obviously, you know, as a parent, having a child who's teething is very unpleasant. We've all been through it here on this call. So keeping those gums as clean and as healthy as possible from as early as possible is really, really good, really important. Or you can always just put brandy, which my mum did to me.
Sometimes it's tempting.
So I haven't got any more questions. So unless anyone has a question they feel wasn't answered, I'd like to really thank you for coming along this evening. I hope it's been as informative. Every time I hear this, I'm not a dentist, and every time I hear our dentist speak, it gets more and more informative. If you have enjoyed tonight and you know anyone who would like to join, we're doing another event on Wednesday, similar event. You've been to this one. So same as tonight, if you know of anyone who you think would benefit from or would wish to hear our dentist speak on Wednesday night, do forward them my email address that you told me you were interested, and I will send them the Zoom details for Wednesday night. And we're always here for any reasons. You've got our address anyway.
One more thing is, please look on our social media. It's Dental Wellness Trust on Facebook and Instagram and Twitter. You can always reach us there to ask questions, and we put information the whole week. We put information for all kinds of things. So thank you so much for the brilliant questions. Thank you for joining. Thank you for listening to us. This is our first event we've done like this, and I hope you find it helpful. Alison will send you some feedback forms just so that we can improve it and hopefully reach more parents and help them in the best way possible. So thanks so much, guys. It was really nice to present tonight, and thanks for your brilliant questions. And good luck with the children's health. Thank you so much, and bye, everybody.
Bye. Bye. Bye.